The digital opportunity. Digital is a big part of the way we all live, work, shop and play. It's how we stay connected to friends and colleagues, and this includes our customers. In fact, 86% of European physicians have a smartphone, and 53% have a tablet. Digital is now at the centre of their working day, and not just digital natives. Even before the pandemic, over half of European physicians communicated with patients via email. Almost all of us already searched for online health information, with patients usually doing so before or instead of a visit to their doctor. 84% of medical consultations made use of digital technologies, and over half of healthcare professionals made use of physician apps. The COVID pandemic accelerated trends like this, and 2020 saw a true tipping point for digital engagement. More than ever before, our customers are living their lives across many channels and expecting to work in this way as well. But why is all this important? Traditionally, the data dissemination journey was linear in the pharmaceutical industry. Information was king. Now, physicians are much closer to the data and on their terms. They seek information when they want it and where they want it. They can access data as soon as it becomes available, meaning they've gone from information to interaction overload. But does our information get through? We said 86% of European physicians have smartphones. So what is the most popular thing that they search for at work on their phones? Drug and treatment information, of course. Is our information there when they're looking? How do we make sure that it is? In 2019, pharma in Europe spent less than 30% of their budgets on digital, with the other 70% going to non-digital promotional channels. Yet during the pandemic, physicians had to spend almost all their working time online, and the signs show that many plan to keep digital engagement at the centre of their work. What should we do to correct this mismatch? We should think of this digital time as the world's biggest 24/7 medical congress. Always on. Every doctor in the world, and payer and specialist and nurse and patient is coming to this congress, and most of our customers are there every working day. How well does our booth stand out at this digital congress? Can our customers find us? And if so, how can we spend more digital time with them? Is it really worth it? Industry evidence indicates that both digital and other non-face-to-face interactions have an increasing impact on sales. Planned and well-executed digital activities mean that we can reach more customers at a reduced cost and still drive sales. Digital should be integral to our strategy in the same way that the sales aid is seen as integral. The era of participatory medicine really is here. And it's not just physicians. There are more monitors, patient apps, fitness wearables and digital health services than ever before. Are we ready? What does our future in digital look like? Digital means that we can go places we've never been able to before, in ways we've never been able to before, and measure it all like never before. Our customers have adapted, and so must we.